Federal, provincial, and municipal public health units are working around the clock in response to the COVID-19 pandemic, with advice coming fast and furious from those official channels and from less official ones like Dr. Google. We're pleased to turn now to Andre Picard, the health reporter and columnist for the Globe and Mail, who joins us via Skype from Montreal. And Andre, how are you doing this evening in La Belle Province?
Good, thank you.
It's good of you to join us tonight. You were calling, actually, I think a week or two ago, for all of us to embrace what they call social distancing now. And I wonder whether the government has responded to those calls in the way that you think is appropriate and that you had hoped.
Well, I think the government has certainly responded to the evidence that this is what needed to be done. I have a platform where I can call for these things, but I think everyone knew this was coming. We saw what's going on in Europe. It's concerning, and I think the government had responded appropriately. I think what's a little difficult in Canada is we're a very big country. The virus is hitting different places at different times. So it's really, the timing issue is really difficult. So people don't always understand why are there measures taken in one province and not another. It really has to do with the community spread of the virus.
Do you think the public has responded with as much force as you would, or commitment, I guess is the better word, to these entreaties from government?
Well, I think in the public, you're always going to get a mixture of people thinking there's overreaction and then the ones thinking there's underreaction. It's really the lot in life of people in public health to never please anyone. You're always going to please, less than half the population. So they have to deal with that. They have to make unpopular decisions all the time. But I think they're doing it relatively well and communicating really well. The communication is dramatically better this time than during SARS, and that's really served us well.
I asked the question because, of course, tomorrow is St. Patrick's Day. And even this past weekend, as some people were sort of getting ready for the anticipated festivities tomorrow, there were lots of people in bars yucking it up and in close proximity to one another. And who knows, what other kind of sort of ill-advised behavior was going on right now. And one wonders whether they're getting the message and what one does to make sure they do get the message.
I think it's really hard to bring society to a stop. I think really people have pulled back in a lot of instances, and it's never going to be 100%. I don't think we can ever be China. We can't dispatch a million troops out to make sure people listen. We're not going to, impose martial law. We don't have the manpower to even enforce orders. So public health officials are saying, listen, we're not issuing orders, which they have the power to do, but they can't be enforced. So they're just saying we're counting on public cooperation. So I think a lot of it is going to be people telling their fellow citizens, hey, a St. Patrick's parade is just not appropriate. Save it for next year.
Let me ask you about the big development today, which was the announcement made this afternoon by Prime Minister Trudeau that Canada would be closing the borders to international travelers, exempting, of course, American citizens. I would like, I guess a two-part question. Let's start with this. Your view on that overall policy statement to start with.
Well, I think it's very much a political statement. So it's fairly predictable. Many other countries are doing it. It's a way of mollifying the public. The second part of your question is probably this, from a public health perspective, will it make a difference? It won't make a big difference. We know that the travel part is relatively easy. People come in, you find out they're infected, you do contact tracing. That's, as public health goes, that's very easy. So that's never been a big issue for them. But politically, I think it was probably necessary at this point.
Well, yeah, okay, you did anticipate the second part of my question. So let me come up with a third part of the question, which is, does it make any sense to exempt the Americans when we know how much criticism there has been of President Trump's, you pick an adjective, but I'll just say lackadaisical approach to handling this issue from the get-go?
Well, again, I think it's politics. I think you have to worry about if you shut out the Americans, there's going to be retaliation. So then there's the risk of, we really need goods and services to flow over that border. So we need truckers, we need rail, we need flights to bring the stuff that's going to allow us to get on with life. And my fear, and I think probably the fear of the government, is that there would be some kind of retaliation for that would be more harmful than actually blocking the border. So I think, again, it's a good sort of middle of the ground political decision.
Okay. Andre, as you look around the world to see the way other countries are approaching this issue, is there one country in particular that you think we ought to be watching in terms of their best practices and what we can learn here?
Well, there's a few countries, I think, a lot of people have pointed to Hong Kong, Singapore, Taiwan. Now, those are all islands, so I think it's very restrictive about what we can learn from them. They're very isolated. They're very singular, closed societies, not they're democracies, but barely. So I think the one we really have to look to is South Korea. South Korea was hit hard. It was hit really early, and it's dramatically scaled back its epidemic, and it's done it with democratic means. So it's done it with social distancing, by appealing to the public to behave in a way that will cut this down. And it's been very, very successful. So I think that's really the model we have to follow. The other thing they've done really, really well is they've done massive testing. So they've done almost 300,000 tests. Canada has done 30,000. So I think we can learn from them that's the next thing we really have to focus on. That's what I was writing about today, is testing. We have a limited number of tests, so we have to use those efficiently, but then we have to really ramp it up, especially now that the virus we know is spreading in the community. This makes it a whole different public health battle once you have community acquired cases.
I'm told one of the things that South Korea has done particularly well is use social media to inform people. If you need a test, here's where you go to get it, here's when you can get it, et cetera, et cetera. We haven't done any of that yet. Are we too far behind in this regard?
We're not as organized a society as them, to be honest. They have really interesting innovations like drive-through testing. People are also, it's a culture where people really listen to government. It's a super respectful society. We're a little different in that regard. So it's always hard to import things holus bolus. But yeah, I think there's really important lessons there about communication. Singapore is also a country where, the communication about this has really been amazing. I saw the president go on there on TV and speak in all 4 official languages in a really understandable way, talking to the people. This is what we expect of you. This is what we want you to do. And people did it.
Can I get your view on China, in as much as that country got off to about as bad a start as you could on this issue? Never mind their approach to handle the outbreak was not great, but they actually pilloried, and treated as a traitor the scientist who discovered it in the first place, who, of course, ultimately perished from this. But here we are 3 months later, and they seem to have broken the curve on it, and things seem to be, again, I don't want to exaggerate this, but they seem to have it better under control right now. How would you gauge the way they've done it?
Well, I think they've certainly done better with SARS. They've been very open by Chinese standards, so not entirely open. They've done a good job of reining this in. But what they've done is unprecedented in history. They've had quarantines of 60, 100 million people for going on 8 weeks now. I just can't imagine that happening in a democracy. So I think we can learn some lessons from them, but I don't think we can apply those lessons entirely to a democratic country like Canada. So I think we're much better looking at a South Korea. The other part of China, I think, that everybody's watching for is, we know that when there are epidemics, there are waves. So we've had the first wave. People, you get it under control, people relax, you lift the quarantines, and then there's the second wave. We saw this with SARS in Canada. The second wave was worse than the first. It was more deadly. So we have to fear that. With the pandemic in 2018, there were 3 massive waves that came within just over a year. So these things are not over quickly. We have to be in it for the long haul, and we have to wonder, how long can we maintain the really strict social distancing? when we close schools, when are we going to reopen them? People are talking openly now about not reopening schools till September. That is going to change the way we live our lives pretty fundamentally. So we have to think about this stuff. We have to think about how long it can be maintained. And I think that's really the key timing issue I talked about before. Why are governments hesitant to do this stuff? Because they wonder how long they can maintain it. So you have to try and find that sweet spot where it's going to have the most impact.
I know there are parents watching this right now who cannot imagine having to deal with their kids 24/7 until September. Anyway, we'll let that go. Let me ask you about the cases we have in Canada, which thankfully are numbered in the hundreds as opposed to the thousands or tens of thousands that we're seeing elsewhere around the world. My question, though, is do you know how accurate the numbers of cases we have in this country are, given that we're really not able to test everybody who may very well have this thing?
Yeah, we don't know the exact numbers. We know the ones we've tested and we found, and we're now up over 400. The numbers are climbing quite quickly this week, and we can expect that climb to continue for at least a few more weeks. And that shouldn't alarm us unduly. We just have to watch the trend. So we don't know. There's an interesting comment yesterday. The medical officer of health in Ottawa said they have 10 official cases in the city. She estimated there's between 200 and 1,000 cases. So if you do that kind of math everywhere, take the numbers in every province, multiply them by 100, is essentially what she's saying. That gives you, I think, an idea of the real number. Now, again, that shouldn't alarm us because we know that about 80% of those cases are going to be mild. Does it matter that we know the number of mild cases? At a certain point, no, it doesn't matter. With the flu, we don't test everyone. We just say, listen, you have the flu, go home and rest and eat Bubba's chicken soup. And if the coronavirus becomes a seasonal virus, if it becomes normalized, we're going to stop counting. These cumulative counts are getting to the point where they're not that useful. They're just distracting.
In which case, do you think the approach in terms of medical advice for people who get this virus ought to be the same, namely just go home and sweat it out?
Well, I think it's a little more deadly than the flu, so we have to be a little careful. I think what's really important at this point is there are good self-assessment tools online in each of the provinces. Get online, go through this little online quiz. It's very easy, and it'll tell you, A, you don't forget about it. You're going to be fine. It's mild. Or B, call 811 and get further advice. Or if you have some really serious symptoms, your lips are turning blue essentially, call 911. So it gives you a really good breakdown of what to do immediately, and a lot of that can take the pressure off the 811 services. Ontario has a 1-800 number. It doesn't have 811, but those services are totally overwhelmed, and we can, as citizens, do our part and not call if we're not in the serious category.
I was just going to say, Andre, I've been, like many other people, I suspect, looking at Facebook a lot over the last couple of days and reading the accounts of many friends of mine who, let's say, have come back from international travels, and they are told to call various numbers, call telehealth or call your doctor, or call this 1-800 number to get expert advice on what to do. No one answers the phones. I think the website for the Ministry of Health in Ontario crashed today. People who want to get tested are told to call such and such a number to get tested. Nobody picks up the phone. You therefore can't make an appointment to get a test, and you need an appointment to get a test. Anyway, I could go on. It sounds like our institutions are completely overwhelmed right now in terms of dealing with the public. So should the public have a great deal of confidence in the system right now?
Well, I think there's no question that systems are overwhelmed, but we have to recognize this is an extremely unusual situation. In certain regards, we're reaping what we sowed. We've cut public health down to the bone, and then we complain we don't have people to answer the phone. So we have to, I think, when this is over, think a lot differently about how we fund these programs and recognize that there's a price to pay for not funding properly. So that being said, it comes back to, I think, we have to do our part. We can't magically create 1,000 811 operators. It takes a certain skill. So we have to do our part. We have to do these quizzes, not call if we're just the worried well. A lot of these lines are being overwhelmed by people who are fine and they're just worried. And you have to not call. You have to leave it to people who have symptoms to get help and to get advice. And you have to be a little bit patient. You have to put a little bit of water in your wine at a difficult time.
I come to you tonight, obviously, from one of the largest cities in the world that is populated by people of Italian heritage. And they are watching what is happening back in Italy and are astonished that a country with 2.5 times the population of ours, which is a G7 country, which is supposedly on the cutting edge of so much in terms of medical abilities, they're in deep trouble right now. And I think many people here are wondering, is it possible that whatever's going down in Italy right now could manifest itself here? What's your view on that?
Well, it unfortunately is very possible. We're seeing almost a repetition next door in Spain. A similar thing is happening. If you don't get control of a virus early, it really just it explodes. For every person who infects 2 others, and it multiplies so quickly. Italy hesitated a little bit, and they're paying the price. And it's really a strong message to us that all this stuff that's being done now, it looks like excessive, closing bars, closing restaurants, closing schools. A lot of people are saying, why are we doing this? Isn't 400 people are sick? Well, we're doing this because we don't want to be Italy. And, if I've said often to people say that I'm scaremongering, etc. And my comment is always the same. I would be very happy if in a month or two that everything's fine and I look terrible. That would be the best case scenario for me. If we act so swiftly and so relentlessly that this doesn't really spread, that would be great.
Yeah, everything.
But, no.
Exactly. Everything I've read about this suggests that the big mistake that health authorities make around the world is that they're too worried about having just the perfect response, that the better response is always fast out the gate, don't let perfection be the enemy of the good, and get to it right away. Otherwise, you're behind the game and you lose. Does that make sense to you?
Absolutely. There's a good viral video going around of Mike Ryan from the World Health Organization, essentially talking about his, very long career. And that's his take-home message is make mistakes. It's better to overreact than underreact. And again, in Canada, we're very, very conservative. We go slowly, and there's a risk of us paying the price for that. It won't hurt us to go a little bit overboard, to do a little harm for some better long-term good.
Well, I always like to say when I plug your columns on social media that for my money, you are the best guy writing about health anywhere in the country. You put the puck in the net tonight, as you always do when we have you on the program. So thanks so much for taking the call, Andre, and stay healthy, okay?
Well, thank you, Steve, and you stay healthy. That's very kind.
Thank you very much. That's Andre Picard, the health reporter and columnist for the Globe and Mail.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.